Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Let's tackle a big question. Does Aetna Medicare cover the cost of assisted living? The quick answer is mostly no, but it's more complicated than a simple yes or no, so it's crucial to understand the details to avoid surprise bills. First, you have to understand what basic Medicare covers. Original Medicare, which is Part A and Part B, does not pay for long-term custodial care. Custodial care is non-medical help with daily activities like bathing, dressing, eating, and using the bathroom. This is the primary type of care provided in an assisted living facility, and Medicare views it as a living expense, not a medical one. Now, where does Aetna fit in? Most Aetna Medicare plans are Medicare Advantage plans, also known as Part C. These plans are offered by private companies like Aetna and they replace your original Medicare. By law, they must cover everything that original Medicare covers, but they often include extra benefits. This is where some coverage can come into play. While an Aetna Medicare Advantage plan will not pay for your room and board at an assisted living facility, which is the largest part of the cost, it can cover certain medically necessary services you receive while living there. For example, if you need physical therapy, occupational therapy, or skilled nursing visits from a nurse after an injury or illness, your Aetna plan would likely cover those services, just as it would if you were living in your own home. It can also cover durable medical equipment like walkers, wheelchairs, or hospital beds prescribed by your doctor. Some specific Aetna Medicare Advantage plans, especially special needs plans or those offering new supplemental benefits for the chronically ill, might provide additional support. These could include benefits like transportation to doctor's appointments, meal delivery, or even a limited number of hours for an in-home support aide. These benefits can certainly help make life in an assisted living facility more manageable and a bit more affordable, but again, they do not pay the monthly rent for the facility itself. The most important thing to remember is the distinction between medical care and living expenses. Aetna Medicare covers your health care. The cost of the apartment, meals, and 24-hour non-medical supervision is considered a living expense, and that is not covered. This is the biggest part of the assisted living bill, and you'll typically need to pay for it out of pocket, with savings, or through a long-term care insurance policy. So how do you know what your specific plan covers? The absolute best way is to look at your plan's evidence of coverage document or call the customer service number on the back of your Aetna card and ask directly. Benefits can vary significantly depending on your specific plan and where you live, so never assume. Always check directly with Aetna to confirm your coverage before making any major financial decisions about assisted living. We hope this clears up the confusion around Aetna Medicare and assisted living. Thank you so much for watching. If you found this information helpful, please give this video a thumbs up and subscribe to our